Hello, I'm Dr. Forrest Smith. I have an internal medicine practice. I'm board certified in internal medicine, 28 years. My practice is called Crabapple Internal and Integrative Medicine in Roswell, Georgia. I do a lot of bioidentical hormone therapy. We do a full symphony of hormone testing. I believe very much in natural thyroid treatments, as well as in adrenal testing. We also do IV nutritionals and nutritional testing and customized nutritional supplements. I went to medical school at University of South Carolina in Charleston and then came to Atlanta for my internship and residency in internal medicine. Having a background in internal medicine is very helpful in what I do now because I'm used to treating men and women, and because of the intense training in the biochemistry and the primary basic sciences, it lends itself to learning more. Balancing hormones has to be not only the adrenals, the thyroid, it's also the sex hormones, and we look at the growth hormones. The term bioidentical means that first, we're not putting anything into the body that isn't natural to the body. We're not using it in any dosages that are not natural to the body. We use what are called physiologic doses, not pharmacologic doses. And we also make sure that we're monitoring to see how the body is handling it. How's the metabolism of those hormones that we're using? A lot of times women will ask, why should I go on hormones? That doesn't seem natural to me. And if you say that you are a natural doctor, why do you recommend hormone replacement? And my response to them is that Mother Nature has one goal, and that is the reproduction of the species. When a woman is done with her reproductive years, we then shut down. As our ovaries shut down, so does our body. If we can optimize those hormones and keep them at the levels that we were in our 30s and our 40s when we were at our prime, then our skin integrity, our bone integrity, our functioning of the mind, of all the organs in the body, everything has a receptor site for hormones, and optimal levels will increase that improvement. I think one of the most startling things in my practice for the last few years is that men have so many levels of hypotestosterone, and many physicians are reluctant to treat it. Number one, I think that they are not aware of the dangers of hypotestosterone, and they also don't have good training in how to approach it. With hypotestosterone, sometimes the presenting problem will actually be elevated cholesterol levels. And you should not treat cholesterol until you've made sure that the hormones are balanced. Another sign might be that they have problems with fatigue issues or lack of strength, they're losing stamina, and they have more belly fat. They're complaining of weight gain around the middle. Those are all signs of hypotestosterone. It doesn't have to be the sexual dysfunction. You don't have to wait to hear the words, I have erectile dysfunction. You need to jump in when you see problems that might be related to it. One of the most important aspects of health is maintaining a healthy weight. And over the 28 years I've been in practice, never before have I been able to tell a patient, I can really help you to lose that weight safely and keep it off. And the way that we are doing our weight loss program now is with the use of a natural hormone called Hcg. The Hcg hormone actually directs the body's metabolism. It tells the hypothalamus two things. It says, number one, keep the blood sugar steady. This is the hormone that's developed in the placenta when we become pregnant. And the job of the hormone is to feed the fetus. So the number one job is keep the blood sugar steady. But number two is we cannot be parasitic on the mother. We have to have survivability of the mother as well as the fetus. So if the mother is in a starvation, if she is in a famine or a war-torn country, then she needs to have the calories to feed the infant, but we cannot do that at the expense of the muscle. So the Hcg directs the body. Do not burn the mother's muscle. Do not burn the healthy fat. Target first any unhealthy fat stores that need to be burned. And that is why the diet is so successful. With the Hcg diet, you can burn 1,400 to 2,000 calories per day to provide the fuel that your body needs. In addition to that, we then put the patient on a very healthy but very calorie-restricted diet. In a period of 30 days, a man can expect to lose 30 to 40 pounds, and women will lose 15 to 20 pounds routinely. When we do nutritional testing, you can't rely on just blood testing. We know, for example, if you do a B12 level, you're going to miss up to 2/3 of the patients who might have deficiencies functionally with B12. So the term functional is important. We don't want to know just what a serum level is, but whether or not the vitamin is capable of getting into the cell and doing the job it is supposed to do. So when we do nutritional testing, we sometimes will do a test called functional intracellular analysis. And the functional intracellular analysis lets us know whether the vitamins are inside the cell and able to do their function. If you'd like to know more about my practice, please contact us at our website, forestsmithmd.com, or call us at 770-594-1233.